The following presentation outlines the steps required for correctly processing patient specimens for the Bennett polypharmacy profile. The very first step in the process is to have the lead provider sign off on screening protocols and standing orders for the BPP. This will allow the medical staff to collect specimens without having to go back to each provider. In this process, each morning, the lab assistant checks the daily patient log to identify patients meeting BPP protocol. Then a BPP patient list is generated. The first responsibility of the collecting medical assistant or lab tech is to bring the patient to the screening area. The collecting medical assistant or lab tech also has the responsibility of consenting the patient for this testing. The consent for each patient reads as follows. Your provider knows you are taking several different medications. He or she would like to check to make sure you're not taking medications that may interact with each other. We do this screening using a urine specimen. Please note that it is the responsibility of the medical assistant or lab tech to fully complete the lab requisition for each BPP. These tests cannot be processed without the following information on the requisition. 7 items: the account name, territory manager, patient name and patient demographics, the payment information, ICD-10 code, and additional applicable codes. Please also make a copy of the insurance information and make a copy of the patient's last progress note. To review this process, the medical assistant or lab tech must fully complete the lab requisition for each BPP. Again, the test cannot be processed without correctly completing this requisition. Please refer to the requisition templates for guidance. Again, this form has to be completed correctly or processing of the specimen will be delayed. One important point to remember for BPP specimens is that these urine specimens can be refrigerated for up to 7 days. Another important point to make is that once a specimen is collected and the requisition is completed and the insurance card and progress notes are copied, place all this paperwork in the specimen bag per your packaging protocol. After packaging, place the specimen in the designated area for courier pickup. The lab assistant should check your online portal on a daily basis for results. 3 steps are involved here. First, make a copy of these results and give to the appropriate administrator or provider in your office. 2, scan the results into the EMR if that's part of your expected office procedure. And 3, notify the front office to schedule patient visits for patients with multiple inconsistencies. This is termed a medication reconciliation visit. Specimen packaging and shipping is a 4-step process. The first is to tighten the lid on the specimen cup to prevent leakage. Make sure the side of the cup is clearly labeled with the patient's ID information. The next step in the packaging and shipping process is to place the labeled specimen cup or tube in the biohazard specimen bag. This is equipped with absorbent material. The third step in this process is to fold the lab requisition form and patient information sheets together and place these inside the paperwork pouch on the side of the specimen bag. Please include a copy of their face sheet, driver's license or photo ID, and their insurance card. Please copy both front and back. And the fourth step in the specimen packaging and shipping process is to place each specimen bag containing the specimen and the paperwork into the overnight shipping bag or box. Use pre-printed labels to ship these packages. Please take a moment to review the four-step specimen packaging and shipping process. This concludes our lab assistant guide on the steps required for correctly processing patient specimens for the Bennett polypharmacy profile.